What are you passionate about? What are things that you love? And for my master's, I had did my paper on maternal health, or like infant mortality rate and those kinds of things. So I was thinking like, oh, maybe I can work with doulas or midwives and those kinds of things because I had no idea of public health consulting. For me in public health, you work for the Department of Health, you work for an agency or a nonprofit. I didn't know about consulting like that. So then that's when something, it was God. He's like, write virtual assistant in this group. And I searched it in, and Vanessa DaCosta, she actually popped up, and I saw she was looking for a VA. And it was like a couple of years ago. And I was like, what would she want a VA for? Like, what is this? I went on her page and I discovered public health consulting. And I was like, oh, wow, this is it. I can help public health consultants grow and scale their business. I can use my admin and operational skills to help them manage their business. And I was like, this is perfect. So ever since then, I've been marketing myself as a public health virtual assistant.
Hey friends, welcome to Public Health Careers. Today we're chatting with Chelsea Vanderkool. Chelsea is founder and CEO of Virtual Collab, where they are your virtual resource and here to support you administratively, creatively, and operationally. She's also program coordinator at Downstate Health Sciences University. Chelsea is someone that is passionate about using her skills to help public health and social impact entrepreneurs achieve their goals, grow their businesses, and travel the world. She conferred a bachelor's in health and nutrition science, concentrating in public health at Brooklyn College, and then a master's of public health in health policy and management at SUNY Downstate Health Sciences University. In today's episode, you'll hear and learn more about how her business supporting public health entrepreneurs earned over $30,000 in their first year. All that goes into navigating working a full-time job while starting a business, as well as learning about public health early in her career, but not knowing exactly how to navigate it or what she wanted to do, as well as much, much more. Be sure to hit that subscribe button and leave a review. Enjoy today's episode.
Hey, Chelsea Vanderkool here, CEO and founder of the Virtual Collab. I'm the strategic partner for public health entrepreneurs, and you're listening to Public Health Careers.
Chelsea, I'm very excited to have you on and to hear a lot about your journey, not only in your public health journey, but how you got into consulting and the work that you do there with the Virtual Collab. So thank you for joining me today.
Thank you for having me.
It is my pleasure. And jumping into things, how do you identify and tell us a little more about your personal background?
Yeah, I go by the pronouns of she, her. Identify as African American, mainly African Caribbean. My family's from St. Vincent and the Grenadines.
Whoop, whoop.
Yep. Born and raised in Brooklyn, New York. Yeah.
Love it. Love my Caribbean people. And I know before the show you're saying that you're going for Carnival.
Yeah.
Make sure you're hydrated because I went to Trinidad Carnival last year and it was a lot. It was a lot. Drink a lot of coconut water.
Yes, definitely, because the sun is hot.
It absolutely is. It absolutely is. So you will get to how you thought about starting your business, the virtual collab, but I always like to start off the shows like highlighting something that you've accomplished in your work. And I wanted to ask, like, you started this business that supports public health entrepreneurs and you earned over 30,000 in your first year. How did that happen?
Yeah. Honestly, I truly believe it's because, God let me know who my ideal clients were, and I had the resources around me, being in public health space or being in the group Black Ladies in Public Health um, group on Facebook, and just being able to search in there and just to know, searching virtual assistants to see that there's such thing as public health consulting, and public health consultants reaching out to me and saying, I need your help. And then they're referring me, and that helped grow my business from day one. Also, to just really good marketing on social media as well.
Well, firstly, kudos to you for doing that. I think that is a hard thing that a lot of people aren't able to do, or like just making that switch and then committing to it and like building out a business that's actually generating like meaningful revenue in a way. And I like the idea of you like diving into public health, knowing that you're a part of these different public health groups, and then kind of just seeing like a gap in it, and then also the need for it because there are people referring you to other people that need this similar type of support, which I think is like just indicative of the need for the work that you're doing.
Yeah.
So how did you get to that ideal client?
Yeah. So, when I started the business, it was just, helping anyone. But then when I discovered public health entrepreneurs, public health consulting, writing in that Facebook group and saying, hey, I'm doing marketing research. What are some things that if you had a virtual assistant that you would, you know, give to them? And then them responding and saying, these are the things I need, and me realizing that and creating those packages around them. And they reached out to me, and we started a package, and it was general administrative tasks. This client, they had a research firm, and they needed help with all kind of different things: email management, calendar management. I think they were helping community health workers, so getting them scheduled for things. It was, yeah, it was. That's how I got my first public health consulting client.
Very similar to people in public health, doing a needs assessment of the community. What are the things that you all need? And then from that, learning that a lot of general admin needs and building that. Would you say that you had that skill set before, or like how did you build that skill set to become an effective person in doing this as a business?
Yeah, no, that's a good question. I want to say I definitely invested in education of like starting a business. So I had the admin and operations experience. I had no clue of starting a business. So I did do a course, a virtual assistant course, and in that they taught you marketing research, getting yourself out there, and for talking to your ideal clients and seeing what they need. So that's really where that came from. And it took a lot of courage, to write in this group with, thousands of people. But I definitely did that for sure.
We always have to take that step toward courageousness and
Yeah.
like the things that make us a little bit uncomfortable, because that's when we know we're pushing ourselves to really like test ourselves and go outside our bounds to just really grow as people, grow as business people, which is awesome. So from that course,
Hmm.
what would you think is the like the best takeaway that you got from that course that you took, and other maybe other resources as well?
Yeah. The biggest takeaway is just start. Just start before you're even finished or you think it's complete. Everything does not need to be put in place. You just need to have a portfolio. You don't need a LLC. You don't need a website. You just have to know how to get the contracts, and send invoices, just the basics. And have the skill set and just start. Take that leap of faith and do it. That was the biggest thing. And they really taught that in the course from the beginning to the end. Like you don't need to have everything. I think we reached like probably module 3, and they're like, start telling family and friends, start doing market research, start reaching out, because you have the basics that you need to show up as the expert that you are to get clients. And it's the truth. So definitely just start. It doesn't have to be perfect, but it just has to have something there.
And getting that word out is so important because no one knows what we're doing unless we tell them, and we never know who's going to need support unless we tell them that those kinds of things. I did have one more question before we kind of move on. Is I feel like many times in public health, I guess maybe just more in general, as people, we might want to invest a lot into school education, but oftentimes like courses that are outside of that traditional structure of school,
Yeah.
it's sometimes something that's difficult for us to think about investing in. Maybe two questions. What was that time delay in like you saying, okay, I want to do this, like I want to do something around virtual assistants or I'm building a business, to actually buying that first course? And yeah, I'll start there.
Yeah, no, that's a really good question. So I want to say it was 6 months. So, say like in July, I was scrolling on TikTok and I saw about virtual assistant. And then I started to do a lot of research on it. And that's how I got the knowledge of like, oh, there's different virtual assistant courses. And so for me, I had to think about what are the things that I need to be efficient. So I look for the courses, I look to see, like, can it help me not only where I am at now, but when I grow? So that was the course, the virtual savvy. That was the one that I did. So it was about 2 months of like research, and then I purchased the course, and then I did the course for a good 4 months, and I launched in January of 2022. So I really took my time with the course to really understand everything. But you definitely need to invest in yourself in order to grow for sure in anything that you do. So that was the time frame that it took me from conception of I want to do this business was like 2 months, and then I bought the course, and then 4 months, and then I launched the business.
And then the second question is, what was that point in time in that few months that made you say, yes, I need to buy this course and do this now?
Yeah. So it was realizing that so I'm a finance girly, as I like to call myself, and at that time, I was really invested into wealth building and just thinking about what's next in my life. And I knew that was wanting to invest more, into Roth IRA or to put more into my 401k with my job, but also to really just wanted to be a homeowner. And New York City is very expensive, and I knew that I needed a side hustle. I knew I needed something else where I wouldn't have to change my lifestyle because I was, wealth building, such as investing more or buying a home. So that's what really made me say, okay, what can I do? And at first I was like, maybe I can start another job, like part time. But I was like, I don't really want to do that. I want the flexibility. And so that's what made me say, virtual assistant, like I have that admin skill and I can work anywhere. So if I do move, it doesn't matter where I live.
And one of the best ways to build wealth is to start a business. So, uh,
Absolutely.
yeah, well, kudos for you for taking those steps, and I'm looking forward to coming back to talking about the virtual collab in a bit, and really, really like digging into some other things around that. But
Yeah.
pivoting a little bit here, what does public health mean to you?
Oh, yeah. To me, public health means like everything around me, my environment, when I wake up in the morning, the utensils that I use, where I work, the people that I'm around. So for me, when I look at public health, it's just like all encompassing of everything. And I really feel as though it's just really breaking down to me structural racism. Like everything around us is based and built on race. And I feel like public health breaks down that system and helps to think, why is it this way and how can we fix it from the beginning? How can things be changed? So I think it's just, everything around us and how we can make it better. um, and it really starts with those upstream factors, that public health, those foundational things that we talk about, and learn for sure. So public health is everything.
Before we get back to the show, are you passionate about public health and looking to elevate your career, brand, and impact? Join the public health community today. Gain exclusive access to career boosting events, connect with like minded professionals, and stay ahead with the latest trends in public health. Plus, enjoy mentorship and career support to help you thrive. You'll even learn tips and tricks on how I grew my LinkedIn by 2,000 followers in the last 6 weeks. Sign up before the end of May to lock in your membership at the current rate before prices go up. Don't miss out on this opportunity to grow and connect. Join us at thephmillennial.com/join or in the link in the description and be part of our vibrant community dedicated to making a difference in public health. Let's build a stronger future together. Now back to the show. Absolutely, and focusing on the structures and the systems around us that impact our health is everything as well. So before your bachelor's degree, I believe it is, you were a peer educator, teens helping each other, as well as a call center representative. Tell us about those experiences, and then maybe about the progression into getting or starting your bachelor's in health and nutrition science in a concentration in public health at Brooklyn College.
Yeah, so teens helping each other, Theo, they're still around. They are truly my start to my public health journey. I started there in 10th grade. It was a summer program, and there we learned evidence-based curriculum on safe sex, HIV/AIDS, healthy relationships, and everyone around me had a master's of public health. And I was like, oh wow, this is amazing. And so I did that from 11th grade all the way up until my first year in undergrad. And so that was my first exposure to public health. We had a conference every year, where different organizations and teams would come, and we would do skits and all of those kinds of things. And after that, I started, you know, undergrad at Brooklyn College. And then I transitioned into working at Brooklyn College. And I did the call center representative for that first summer as I was doing the transition. And for that, it was 311. So helping with like non-emergency phone calls that will come in, like noise complaints or something like that, for the city. But yeah, Teens Helping Each Other Theo was really my start, my entrance into public health. And so everyone around me was like, "Oh, you should do the MPH." And so when I started there, I realized that I liked the event planning, I liked the admin. I wasn't so much liking the education piece, like going out and talking. And so they were like, "Oh, you should do a Master of Public Health and do a concentration in health policy and management." And I was like, "Okay, I'm going to do that." um, and so in doing that, when I started Brooklyn College, they had just started a program where you can concentrate in public health. So I was like, wow, I'm really on the right path.
Yeah, that's actually very, very prolific. And that's awesome that you were able to be a part of that program recently and get like that education around that evidence-based program, but also get the exposure to people with MPH degrees. Because I know for me, that didn't happen until very, very late into like my collegiate career. And I think it's just so important to know, to get exposed so that we know what is out there and what those opportunities are, and like have those conversations and then think about, or concentration in public health, that's something that I can do, and all these different things. So that's really awesome.
Yes, thank you.
Yeah, yeah, you're most welcome. And while you were at Brooklyn College, you shared that like you worked for the college as well as you were an executive administrative assistant at Maimonides Medical Center. I hope I didn't butcher that name. Tell us about those experiences.
Yeah. So when I was at Brooklyn College, I knew I wanted an on-campus job. It was just way more convenient. So I was doing beverage management. So when we had the different activities on campus, I would be the one delivering it. And sometimes when we had events, so say like the president office, I would serve the beer and the wine. But that really taught me management because we had to make sure we had enough of the beverages that was coming in for what was going out for events. But in that role too, I worked in the office and did some admin stuff. So that was a job that happened during the school year. So in the summer, it gave me the opportunity to do different internships. And so one of the internships that I did was at Maimonides Hospital, in the psychiatry department. And that gave me more of that hospital experience. I was working with the chair at the time, and his assistant, and they're like admins there. And so, that was like seeing hospital admin things on the back end and credentialing not clients, credentialing physicians, or just like when new physicians came on and onboarding, also helping with the residents as well. At the time, I didn't even realize it. So yeah, that was my hospital experience at Maimonides.
And before we move on from your undergrad experience, were there like any big takeaways that you wanted to share with us?
Oh yeah, I mean, undergrad was really good. Um, Big takeaways for sure is to like really, meet and get to know your professors. I think that is so important. I still talk to my professors to this day. Um, and they can give recommendations for anything. They can let you know about jobs, and also too networking with your classmates, whether you're sitting next to them, talk to them and say hi, because your network in school, especially now, like in this job climate, everyone's like, it's who you know, it's who you know. And it's like, how do you get to know these people? It's through your undergrad experience. So really network, look at it as a networking, not just you're going there to learn, of course, yes, but also to network. Speak with people, not just when you have group work, speak to your professors, get to know them. It's going to help you in the long run. I would say that's my biggest takeaway. And also too, to invest in a planner and write everything down. The syllabus is your Bible.
Yeah, absolutely. Having everything on a calendar ahead of you is just so helpful when all different things are pulling at you.
Yeah.
Um, And networking is especially important nowadays with the influx of people into public health. Like really having those connections and those real relationships is important. So huge advocate for that as well.
Definitely.
And after you graduated, you had two positions before you went on to your Masters of Public Health. So the positions were data entry specialist at Professionals Group Plan and at administrative assistant at Downstate Health Sciences University. Tell us about those positions.
Yeah. So right after undergrad, I knew I was going to be starting the program at SUNY Downstate. So I too again looked for on-campus jobs. And I guess because it was more graduate program, there wasn't really a lot of like on-campus ones. So I end up getting a actual job. So in that time of undergrad, it was a two internship classes that I took. So a friend of mine had recommended it. They're like, "This is really good. You could get your credits and do internship." So I asked my mom because my mom she works in health insurance, professional group plans, and they're a general agent. So when organizations they wanted to give their employees health insurance, they would use GAs who would then work with the carriers to be able to get coverage. So that was my health insurance experience at professional group plans. And I did that for a while. And then I transitioned into while I was looking for jobs on campus, getting an actual job. And that's the one I got in the College of Nursing as administrative assistant. So working in the health insurance field, it's a lot of data, it's a lot of numbers. You have to really be careful what you're looking at, but it really taught me a lot about, how health insurance works and all the different terminologies that they have. So when I started the administrative assistant role in College of Nursing, that opened me up to the world of how medical education works. So, bursar and registrar, because it was a new program. It was a new certificate program for nurses who wanted to get experience in education. So I was essentially the administrator for that program. But I was working with the dean at the time who worked with grants. So she secured a lot of grants for the College of Nursing. And so that opened me up to the consulting space because there was a data consultant who came in there, but also too just learn about the different grants, NIH, um, all the different ones we worked on. And so I got to see the process of how grants work, and also too how medical education administration works as well.
That's very insightful information. Like going from like learning about insurance because we all know insurance is very hard to
Yeah,
understand, especially like even as someone with like a master's of public health degree, it is challenging to understand what insurance is, what it means, and really diving deep into that. And I think like also grants are very important to understand in public health because they're everywhere in so many different ways, and they're just a lot of opportunity for work. And I think I also like how you highlighted from the grants, it allowed you to realize that there are people that are consultants on the other side that are like supporting some of that work and really opening your eyes to like that type of work, which I think is also important to kind of realize that this field is out here and you can also consult while you work, and like just knowing that is cool.
yeah, definitely. Yeah. And a lot of big organizations, they consult with a lot of people because, when the projects come on, the staff is already at capacity. So you either need to hire more staff or you consult it out. So in this case, with the data and like finding and doing the research, they had a consultant for that. So she came on to help with that because, when you're applying to different grants, it's a lot that goes into it. There's project management, but just tracking to make sure that everything's okay. You have to write it. You have to make sure that, the proposal that you're going to give is really, really good. So it takes a lot of time and team members needed to help to get it done.
Yeah, especially depending on like what type of grant it is, they
Yeah.
do ask a lot, and to that point, it's like you have to do a lot of research and then format things in a certain way and have this kind of information. So yeah, there's
Yeah.
a lot that goes into it. And you alluded to it before. You got your Masters of Public Health in Health Policy and Management at SUNY Downstate Health Science University. What was that thought process from your undergrad to think about, okay, let me get this MPH and pursue a master's level degree?
Yeah. So, I kind of knew what I was gonna do, and I knew I wanted to concentrate in health policy and management. And I honestly went back and forth, like, should I do an MPH or should I do a master's in healthcare administration? And for me, I just really enjoyed everything that I was learning in my undergrad program, and I wanted to continue to learn that. And I felt as though that the management or administration piece of things that I would be able to gain more experience on, but the concepts of like public health and everything, I felt like I needed to learn that right then and there. So I pursued the Masters of Public Health, and it was just an amazing program from the beginning. I had an advisor, and I still talk to her to this day, and she really helped me like navigate and go through the program, and it was a really amazing program. Like, I don't have anything bad to say about it. I learned a lot. A lot of the concepts were familiar because I did in undergrad, so I think that was really helpful um, for me. Um, and yes, I forgot what else. I
That's
forgot
fine.
what else you asked. I'm sorry.
No. That you answered the question, and I think that that thought process like makes a lot of sense. And I share very similar things if people are thinking about an MHA versus an MPH. Is like you can get a lot of the same things if you want to work specifically in just healthcare administration. Like maybe the MHA is better for you, but if you the MPH just gives you the ability to be a lot more flexible with it. If you want to work in healthcare administration, you can do that. If you want to work outside of that, you can do that, and it just really gives you that more flexibility. I think to really do that, and like to your point, also gives you the concepts of public health because too often healthcare administrators. I was in many classes with MHA students. So their mindset on things are very, very different from public health people.
Absolutely, yeah. Because it's like I feel like sometimes what it gave me is, yes, you can focus on the administrative, you can focus on the operations piece, but like with public health, it makes you think of the why for things. So anytime I'm looking at a scope of work or doing anything like that, I think, why am I doing this? And it just helps me to execute the work better. And I feel as though that's what I got, in the MPH program. It just gave me a bigger picture of like how to look at things and all the other factors, not just I got to do this task, this project. It's like, why am I doing this? What are the other things that can affect it? So yeah.
And while you were in your MPH program, you were a case manager at the Star Program Health Center. Tell us about that experience.
Yeah, so at STAR program, I worked with patients who are high risk for contracting HIV/AIDS. So I was helping them to get on PrEP, which is a medication that they can take. So a lot of my the patients, they were on PrEP, and a lot of them, they didn't have health insurance. They didn't have access to healthy foods, or maybe they had like housing issues. So, or a lot of them, they needed mental health counseling. So it was really helping them, yes, be healthy and, be on PrEP and reduce their risk of contracting HIV/AIDS, but also to the other factors that can negatively affect them from, taking their pills daily for it. So, making sure that they had food, they had health insurance, they had access to a mental health counselor, and also too just making sure, like, you're going to your primary care physician. So that was a really great experience for me, in learning that, yes, it's the truth. Like, okay, yes, we learned it that different factors really affect you, but I'm literally working with patients where the factors around them, like housing, their environment, was affecting them through health, their health wise. And if you help them to get those things, their health outcomes are way better. So I just helped manage that process for them. And it was a really humbling and great experience.
Sounds like a very insightful as well as like close to your heart type of experience. So,
Yeah.
uh, and I feel like you can get so many of those while you're in public health. So glad
Yes.
that you're able to get that. And did you have any big takeaways that you wanted to share about your experience in your MPH program?
Yeah. I would definitely mention the network piece again, of like really just getting to know everyone around you, but the concepts that I learned, I will never forget. It's just something that I'm going to carry with me forever. Um, but the biggest takeaway I would say is to just apply everything that you learn, and don't just look at it as another class. I feel as though it's very easy to want to get things done because you want to get the grade. But I feel like in public health, it's just so much more than that. Like you really want to absorb it. So I want to say, yeah, my biggest takeaway is just make sure you absorb everything that is taught to you. Of course, not everything you're going to remember, but those main concepts. It really makes you look at life differently.
Very practical concepts that you learn in public health. And I think, like, to your point, many times in classes, you're going through projects and experiments that actually mirror many of the things that you will or can do as a public health expert. So, like, really, as you said, apply yourself, bring things that are interesting to you into the work, and then really like drive forward because there's so much that you can learn while you're in your program.
Absolutely. Yeah.
And as you were graduating, did you have any like thought process for like what would be your next steps, or how did that work for you?
Yeah. So for me at the time, I don't know, I guess I'm a hustler or it's like my Caribbean, in me. I was working two part-time jobs. So I was working the College of Nursing and I was working Star. Um, and because it was, yeah, so those were like full time, right? So I was full time getting my Master of Public Health. But I knew that for the College of Nursing, it was more like contract. So it was going to end soon. And then I knew I was getting my master's. So I was like looking for something more full time. So I was looking for things at Downstate where I was currently already working. I knew for sure that I was going to come out and manage something. I always see myself managing, I don't know, maybe a department in a hospital or staying in medical education as an administrator, doing something like that. So I was, fortunate enough to get a job as assistant coordinator, like I want to say my last semester. So I kind of just stayed there ever since, and I'm continuing to work there until now.
And while you were there, I believe that you moved up from like assistant coordinator to program coordinator. Is that correct?
Yes, that is correct. Yeah. So after 2 years, I was promoted to be the program coordinator. And it was definitely nerve wracking at first because it was like, this was my first big job and title for me. And but the person who was the program coordinator before, she had a well-oiled machine working, and I have an operations mindset, so I always met with her, wrote things down, created processes for it. So I was very secure in what I needed to do, and felt very comfortable with the team that I had, because they really is a great team.
And what were the kinds of things that you had to do firstly as like assistant program coordinator and then as a program coordinator?
Yeah, so I want to say as the assistant coordinator, it was more of the day to day of the residency program. So I'm the program coordinator for emergency medicine. We have 90, I think it's like 96, but at the time we had 98 residents. And then there's a leadership team. So we have a program director, and so it's really making sure that the program is compliant with our accreditation body. And so it was a lot of the day to day work. And, when it came to the different events that would happen. So there's interview season where we're interviewing medical school applicants to make sure that, to bring them on into our program. So assisting with those kinds of things. And then we had graduation, and then there's orientation. So I was managing a system that we use, a residency management tool, as the assistant coordinator. So it was a lot of systems, day to day operational things. And then when I transitioned over to the program coordinator, it was more a higher level of like managing and making sure that everything was flowing. Um, you know, so making sure that like when people were onboarding that they had the residents, they had everything that they needed, or like actually planning the orientation, planning the graduation, planning the interview season. It wasn't just like, oh, I know that interviews is Tuesday and Thursday. It was like, no, you have to set up the Zoom, you have to set up the days, so like really doing the higher level things, while also supervising the new assistant coordinator. So that's where I learned my leadership, my management skills. And my thought process was always, treat people how you want to be treated. But I had to learn that not everybody works the way I work. So that doesn't apply. Like sometimes people need a little bit more help and more guidance. So yeah, that I really learned a lot in terms of supervising from transition. That was the biggest thing. I was supervising somebody else.
Yeah, that is a big transition for sure.
Yeah.
And maybe like to that point, what are some things that you've learned or advice around supervision or looking over someone supervision? Yeah.
Yeah. Well, one thing for sure is don't assume that people work the way you work. Don't assume that if you're someone who doesn't need micromanaging, that you don't have to micromanage someone else. And not to say to micromanage them, but sometimes people need a little bit more of a nudge of like, or a reminder for things. So that's one of the things that I learned for sure. Also, too, it is so important to create a process for everything that you do. Anything that's recurring, create a process. It cannot live in your brain because when you have to delegate that thing, you want to just say, here you go, or let's go on a meeting, and then you can just ask me any questions that you have. But also too, just really being supportive for people, and giving them feedback in real time, and just saying thank you. Like that goes a long way, like building a work culture where people feel supportive. If they make a mistake, they're going to come to you and tell you instead of hiding it. So it really goes a long way to be kind and supportive when you're supervising someone.
Yeah, yeah. Thank you for that. That's a great insight there, and and I resonate with the standard operating procedures, like putting everything down on paper, creating videos if you have to do that, because yes, things live in your head, and sometimes it's more difficult to like translate that and share that. So really like getting clear on that and working through those processes, I think, are so important, and something that's overlooked in many aspects, I guess business wise, and then in personal life as well, if you're doing that kind of stuff personally.
Yeah, definitely. I feel as though like anytime you have something, you wrote it down, or you didn't write it down, you're just doing it over and over, you should write it down. You should do a video recording of it. Like you said, in both business and personal, because it just makes life so much more easier.
Right. And you could also like from that understand which steps probably aren't important,
Yeah.
or like things like that, leading like inefficiencies and like creating more efficient systems.
Yeah, definitely. Also, too, the person who's coming on, they could say, "Why were you doing it this way?" And they may have a better idea and be more innovative for it. So it's better when people can see it and experience it and say, this can be done better, or there's a step missing. You may know it in your head,
Mhm, mhm.
but you didn't write it down because you kind of like overlook it because you just do it all the time. So having someone else look at it is and go through it is the best thing.
That is absolutely true. I couldn't agree with that more. So in your, because you're in this role currently, what are things that you get most excited about? What are things, yeah, you get most excited about in this role?
Hmm, that's a good question. Hmm. Honestly, for me, I want to say it is I get excited when interview season is over because it's a lot. We interview like over 300 people, but it's rewarding when we know who we match with and they're onboarding, because for a lot of them this is their first job. This is their first real life experience, because they were in the books for so many years, and it's like now I have to really apply what I learned. So they come with a new fresh perspective, and it's really great to meet them, and connect with them and get to know them and just be a part of their journey into residency, because it is a big change. You go from studying to working 60 hours a week, and it's just like, wow. So just being there for them, like supportive, as well as administratively making sure that they have everything that they need. We send lots of follow up emails. A lot of them don't read it, but that's what we're here for. So I would say that, and also too, the leadership team that I work with, they are so dedicated. Like their drive to educating the residents and making sure that they're, diverse is like the most amazing thing for me. And I'm really happy to be a part of a team like that.
Kudos to your team.
Yeah.
You are also a collaborator and consultant at We Public Health LLC.
Yeah.
Tell us, how do you come across that, and like what do you do in that work?
Yeah, definitely. So, We Public Health, I came across it from Vanessa, my client at the time. We Public Health had put out like an announcement saying like we're looking for collaborators, to join, and some of the things that they listed were like admin and operational. And I was like, oh wow, this is really cool. So, I filled out the application that they had for it, and I met with the CEO. Well, she calls herself the managing director, but she runs things. Jennifer, and she was like, "Well, the work that you do is really amazing, and I need help with those things for we." And so my team and I, have been working with we for over a year now. So now I'm a collaborator, so I'm a part of the collective, and as well as I work on the back end for we as a collaboration manager. So just really building those foundational things because we is growing. There's so many people who are interested. The consulting field, especially in public health, is growing, and they want to be a part of an amazing work culture where women are able to work in their zone of genius and be leaders in it, but also be collaborative, and go after RFPs and just have the support. So I'm really helping like build it up, and it's an amazing experience. It's something new, and it's exciting.
That's really cool, and I'm looking forward to talking with Jennifer. I think she should just schedule some time on my calendar, so
Please.
we will get the insights into We Public Health and the thought process into that, and how things are growing and developing very very soon as well. If not before this, depending on how I put out episodes. But
Right,
yeah, that's
definitely.
that's, that's awesome. That's awesome. And then I guess coming full circle now,
Yeah.
coming back. So you are the founder and CEO and principal consultant at the Virtual Collab.
Yes.
You shared a little bit about the journey of like starting this. Well, tell us a little bit more about that. Like, when was that in your journey that you're like, okay, I want to do this, and then you decided that you wanted to pursue a course. You did the course, and then you started the business. Tell us about that progression.
Yeah, so it was in 2021, when I got, that drive of like, okay, how am I gonna bring in more money? What are some things that I'm gonna be able to do? And scrolling on TikTok and seeing virtual assistant, I'm like, oh, what's this? I can do this. And I'm a very strong proponent in investing in yourself. So I invested in a course. 2 months after I did that course for 4 months, and I knew January 2022, I was going to launch. And I got my first two clients through doing the course, like through Upwork, where you can like, Upwork Fiverr, you can look for help. It was a business coach and it was a lawyer. And when I was working with them, it just felt like another job for me. I didn't really enjoy it. So I had to think back, well, Chelsea, what are you passionate about? What are things that you love? And for my master's, I had did my paper on maternal health, or like infant mortality rate and those kinds of things. So I was thinking like, oh, maybe I can work with doulas or midwives and those kinds of things, because I had no idea of public health consulting. For me, in public health, you work for the Department of Health, you work for an agency or a nonprofit. I didn't know about consulting like that. So then that's when something, it was God. He's like, right, virtual assistant in this group. And I searched it in, and Vanessa DaCosta, she actually popped up, and I saw she was looking for a VA. And it was like a couple of years ago. And I was like, what would she want a VA for? Like, what is this? I went on her page and I discovered public health consulting. And I was like, oh, wow, this is it. I can help public health consultants grow and scale their business. I can use my admin and operational skills to help them manage their business. And I was like, this is perfect. So ever since then, I've been marketing myself as a public health virtual assistant. I follow public health consultants. I put it everywhere. Like this is my target audience. This is who I help. In public health or in the social impact space, this is what I do. And so that's the only clients that I have attracted and have worked with, thankfully, for the past 2, 3 years.
Good point in like highlighting like you starting doing it and then you went to Upwork, Fiverr, and then even in doing the work in itself, you're realizing like this is not the ideal client that I do want to work with, and pivoting, which I think is important. Not saying like, oh, I don't want to do this at all,
Yep.
but let me see what's available. Searching in the group, finding Vanessa. Shout out to Vanessa. I think she's awesome.
Yes. Who later
And
became a client, full circle for me. And I was like, wow, like this is amazing. So that's how I knew. I was like, I'm exactly where I'm supposed to be.
that's lit. That's lit. And I wanted to ask. So did those come before? Did Vanessa come before that January 2022 start date, like business start date?
No, yeah, no. Vanessa came, I want to say a few months, if not the next year. She came. Yeah. Yep, she came
Oh,
January 2023. Hmm.
okay. Well, tell me about the early days of like and like what was marketing look like? How did you market and get the word out of your business?
Yeah, so I'm very much introverted. But when I came out,
I wouldn't be able to tell.
oh wow, you know what? Being in this business, you have to really learn. Like, you just can't. You gotta talk. I'm learning. I'm getting there. But when I came out on Instagram, it was very reels heavy. So I was like, "You telling me I can't create these nice, pretty pictures? That is,
I felt the same way.
like, I gotta show my face. I gotta remember the sounds. I gotta do a little dance. I gotta show people the background of my house and all of this. Like, it was insane, but I was so dedicated because this is what everyone was saying is how you get it out there. People are not gonna know what you do. So it was a lot of reels, a lot of like looking for the sounds, doing, knowing what to say, thinking of the concepts. And so really creating a whole social media strategy around mainly Instagram at the time, and then doing a lot of market research. So I was able to use that Facebook group to like look for other consultants or see who Vanessa was connected to, look at her followers, who were they following, follow them, comment on their pictures, so engaging with them. And then the discovery calls just started coming in. Like, people saw what I did. And I think that's the thing too. In public health, people know what they want. And maybe because that's just like who the clients that I have the privilege of working with, when they come to me, they know what they want. They know I can help them, and we work together. Like, it's very straightforward. But yeah, so it was mainly Instagram at the time, a lot of reels, a lot of thinking of concepts and what to say, and just thinking about their pain points and what is it that they want? What do they feel like they're missing out on? How can I support them? So yeah.
Leaning into that uncomfortability of doing things that we don't that we don't. It's a path to growth.
So uncomfortable. When I tell you cringe, when I used to like shake to press like upload, and
Mm.
I would never look at it again. So much memories, but it was so worth it. It was so worth it.
Absolutely, absolutely. So, what kinds of services? Before I get to what services, who would you say is your ideal public health consultant client?
Oh, I would say all of the ones that I have now. Can I name drop?
That's up to you.
Yeah. So all my clients now, Jennifer McKeever, Joy Washington, Quisha Umemba, Vanessa DaCosta. So many of them I've worked with. Zoila, they're all my ideal clients. Their businesses are different. They have the drive. So for me, it's like a public health and social impact entrepreneur who took the leap of faith to start a business, and they're changing the world. Like, my clients are changing the world. They're changing individuals, they're changing communities, and they're building it to be better. That's my ideal client. And it's so amazing to me, but I get to work with them. I'm like, I'm so lucky.
All wonderful ladies. I think I have had all of them on this podcast before and worked with
Yeah.
many of them in different respects. So shout out to all of them as well. Um,
Yes.
so you mentioned that you do general admin support for consultants. What other types of services do you offer?
Yeah. So another big piece of it, and I think it goes hand in hand, is like that operational piece. So when I talk about building a sustainable business, it's like implementing systems, implementing standard operating procedures, or thinking like, how can we do things better, or just streamlining a lot of their workflows and processes, helping with project management. Um, Helping with onboarding and offboarding their clients, or maybe they're subcontracting and having teams come on, or maybe they're launching something new and they need help with getting on podcasts, or getting in a magazine, or speaking engagements, so pitching for them, building that visibility. Um, and yeah, those are the main things. And under admin is a tons of stuff. It's more of like what I don't do. So all the time they're like, well, Chelsea, can you help with this? And I'm like, yeah, I can help with it. Or have you done it before? No, but we can learn. It's just, once you show it and learn it, we can do it.
That makes sense. And
And as
what
well
do
as
you
travel, I always forget about. It's so terrible. I don't know why, because I love the travel piece. So we help with personal travel as well as business travel. I am a travel
Okay.
agent. I've been a travel agent before I knew what it was, and so I really help with that piece as well. Because sometimes they're traveling a lot to different conferences, or they feel like the back end of my business, the virtual collabs, got us. Let me take a vacation. We plan it. You go, and the business is running.
Yeah, love that, love that. And I'm glad you didn't forget to mention that as well.
Yes.
And what's something that's most rewarding for you in doing this work?
I think for me, it's seeing my clients being able to get back into that zone, um, to really focus on the work that they started their business on to do, their bread and butter, the things that they enjoy, um, or just getting like that work life balance back. Also, too, just seeing that their business grow and be a part of it. Like when we first signed the contract, to when it's renewed, their business is usually in a complete different space, whether it be a pivot, or a growth in contracts, or a ton of members wanting to join. Um, it's just to see the transition. So for me, that's rewarding, and to working with them, um, who took this leap and started this business and it's just growing. It's so amazing to be a part of it. It really, really is.
Love that, love that. And you were sharing with me before that you plan to turn this business into a full-time career. Tell us about the steps that you're taking to make that happen.
Yeah. So, definitely continue to show up on social media, so not only Instagram, but, on LinkedIn as well. Um, doing lead generation, but most of all, providing quality work. When you provide an amazing service, your clients do the marketing for you. And that is exactly what is happening to me. My clients are telling their colleagues about me, and they are coming for support. So just keeping up with that great work, um, and the work ethic that I have, the work ethic that I pour into my team, or that my team members have, um, that is what I'm doing. I'm, continuing to create a referral business where my clients are referring me, but also to where I'm also, just making sure I promote myself and, show myself on social media as well. Um, and other things that I'm doing. Also, too, I am getting on podcasts. I'm talking about what
Right?
I do. To get reach for it. And I think that's truly helping my business grow.
Love it. Well, I'm glad to have you on and tell your story. I think it's a good one, and I look forward to seeing all the work that you do and continue to do in supporting those public health entrepreneurs and social impact entrepreneurs in their work as well.
Yes, thank you.
Yeah, yeah, you're most welcome. I have written down here that you also said that you were a financial girly, and you also mentioned a Roth IRA, and I actually love talking about finances. I don't know if
Yes.
people
Oh,
know that, so just
yes.
wanted to kind of like being a financial girly. I feel like we don't talk about finances just generally as people in public health.
Hmm.
What are some of the maybe like things that you wish you knew younger around finances?
Yeah. I wish I knew the importance of a budget. Having a budget is so important. I wish I knew more about investing. I don't have any student loan debt. I went to, CUNY, and then I went to SUNY, and being in CUNY, they give you a lot of like grants, and you get scholarships and those kinds of things. And sometimes you get refund checks. And I wish that I would have invested it in, something. At the time you turn 18, you can start investing. So I wish I knew about that and really budgeting. Um, that's something for sure I wish that I knew about. I wish I knew about all the great books, Rich Dad, Poor Dad, um, or like the podcasts, like the Anthony O'Neill podcast, or like the Better Wallet course, um, who just talk about all these great things about, saving and investing. Those are the things that I wish I knew, but I know now, and I love to tell my friends about it. Um, or the importance of life insurance. Oh, like getting life insurance at a younger age, the quote is like even better. But it's a lot of things that our parents didn't know. So, we learn from the internet. Like I learned a lot of these things from YouTube, and well, at that time it wasn't really TikTok, mainly YouTube. Yeah.
Yeah, well, thank you for sharing that. And I think that's a sentiment that many people do feel like I wish I invested earlier. I wish I knew about these things.
Yeah.
And I think like just us having this conversation here is helpful, and hopefully it prompts someone to like do some more research to learn a little bit more about it and get more involved in your finances, because it is something that we miss, but it's tied to health as well. It's tied to your well-being as a person. So it's
Absolutely.
something that's very important.
Yeah. And another thing too is a high yield savings account. Oh my. What? I would have the pennies that they give me in my regular bank is ridiculous.
That's real.
Oh my gosh. I wish I knew. I wish I knew. Um, put your money in a high yield savings account immediately. I'm telling you. Just please.
Absolutely. I closed my Bank of America savings account when I learned the disparity
Yeah.
in the interest rate that they are paying you compared to like Capital One or SoFi. Hopefully by this time this episode is released, I'll have a promotion code for SoFi. Join below, join a high yield savings account. I also that's where my high yield savings account is right now.
Nice. Yeah, I have mine at Ally. But so far I've heard great things about too as well. So yeah, when I found out, I took my money out of Citibank immediately. I still the savings is in Ally.
Same.
And that interest is there. Interest rate is high right now. We're in a good space. We're not
Right.
complaining.
Right, right. Maybe a few years ago it didn't matter too much, but where the interest rate is now, the yield that you get on high yield savings account makes a lot of sense. It's like
Does.
four plus point percentage points. So
Yeah.
it's a lot more than the 0.01 that the bigger banks are giving you. So definitely switch across to high yield saving. Hopefully there's a link below by SoFi by now, but if not, just join SoFi.
Yeah.
And then before we move on, where can people connect with you and connect with the virtual collab?
Yeah. So on Instagram, it's Chelsea Yavanda, Yvanda. I think there's an underscore. Or it's underscore the virtual collab by CY. Same on Facebook, Instagram, TikTok, the virtual collab by CY. That's where you can connect with me.
Awesome. And I'll be sure to link those in the show notes. Your LinkedIn will be linked in the description, but the show notes will have all the other links there. So definitely check those out.
Yeah.
So moving you on to the Furious Five, the five questions that I ask all guests. Number one, what advice would you give to a student trying to pursue a career in public health? Just this.
The advice I would give is to not give up on it. because it is such a rewarding career. It's broad, but yet it's niche, and you make such a big impact in the work that you do, and you can work in so many different spaces. So I would say just to keep going, to make sure you absorb as you go, and don't just think about it as another assignment, but to really truly understand the concepts because it's going to take you far.
Number two, if you're talking to someone wanting to get into your position, I guess both in your program coordinator role as well as a CEO founder, what advice would you give them?
Um, yeah, so for program coordinator, the advice that I would give is to really have a planner, take your time, learn the concepts, and to just over communicate and don't be afraid to ask questions. And once you have that coordination mindset, you'll go far. And always improve processes as you go. If you see something that is like outdated, like too many paper, be like, let's use this system that we're paying for and file, files things there. And then so for the business side of it, it's to invest. You have to invest in yourself, whether that be a coach or a program. Your return rate is going to be amazing. It is worth it. And if you don't have the coins right then and there, you need to save it up, get that budget, start saving. And once you have that, invest in coaching, invest in a program. It's going to take you way far.
Number three, what's something you're working on improving in your life right now?
Oh, so, I'm building a team and I'm learning a lot because, at my job, I'm managing one person, but on the virtual collab side, it's managing, 3, 5 to 6 people at a time. And so I'm really learning to be intentional in placing people on tasks that they have the best skill set for, but also to giving feedback. I really, really struggled with giving feedback to people because I didn't want to hurt, people's feelings. It was just very uncomfortable for me. But I had to realize that if I'm saying that we provide quality, then that I have to give feedback to my team members. And once I say it in a nice way, that they're open to it and they don't look at it as bad.
Love that. Number four, professionally, do you recommend anything?
Yeah, I recommend you definitely understanding finances and wealth building. That is so important. Knowing about budgeting, knowing about investing, Roth IRA, a 401k, life insurance, the different types of accounts, like having a high yield. Um, that's what I would recommend. I recommend you reading finance books or listening to, podcasts or YouTube about it and really learning like how can I make sure that my finances are good or that I am ready for or planning for retirement or just having a emergency savings account. Oh my God, that's it right there. Have an emergency savings account, please. It is the best thing to have. That is it right there.
That hits hard because I just had like a $2,000 car repair, and if I didn't have an emergency savings account, I would not be smiling right now, bro.
Right?
Yeah,
Right. You're like, how am
it's
I
real.
gonna do this?
It's real. It's real. And then number five, last but not least, if there was one piece of advice you'd give to your younger self, what would it be?
Yeah. Um, keep going. Whatever you're going through right now, it is only temporary. It is just a test for your testimony. And that you are just so smart. You just have to apply yourself and you're gonna go far. Um, and just continue to invest in yourself.
And far you are going to go. Chelsea, thank you so much for coming on and sharing your story and your insights. I enjoyed the conversation a lot.
Yes, thank you so much for having me. It's been a pleasure.
Yeah, yeah, of course. Looking forward to seeing where the virtual collab and yourself go in the future.
Yes.
And we'll be there to support. So, housekeeping items, everyone. Thank you all so much for watching this. Hit the like button if you're on YouTube. Be sure to subscribe if you have not as yet. Share this with a friend, and also leave a 5-star review. We greatly, greatly appreciate that. Peace, everyone. See you all next week.